We are live. What's the date? December 16th, 2020. Here in Boonville, Missouri. Woke up to snow and all that, and cold. I guess there's a big storm developing and headed for the northeast. I saw it yesterday, so I really figured we'd get a lot of snow today. It's now sunny. So what we are going to talk about is not snow. It is niacin. And this one's going to be a little bit difficult, bouncing back and forth between what may be beneficial versus what may not be beneficial. And this started after a person asked me if niacin would help stabilize a carotid artery intimal thickening that was found by ultrasound. Her functional medicine physician recommended an aspirin a day at 81 milligrams a day and a statin. I can't remember which one. Most of the studies with statins and niacin are simvastatin, if I recall. Also some studies with fenofibrates, and so we'll get into that. She does not want to take a statin and asked about niacin. I thought that was a reasonable idea. Her total cholesterol is just a little bit over the recommended cutoff, 206, I think. But her HDL is 89. And her LDL and triglycerides, her LDL is I think 132 and her triglycerides are about 70. So the reason for the aspirin and the statin was the carotid artery intimal media thickness found on ultrasound. She's not had a cardiac CT index scan, and another functional medicine doctor thought that niacin for her would be a bad idea because of the potential of calcifying the carotid artery intimal media thickness area. So keep in mind there's no study on her carotid arteries, and she's had a fairly good cardiac workup with a full lipid panel, a lipoprotein A level, myeloperoxidase. She had not had a homocysteine level. So if you remember all the stuff that we've talked about for checking out your heart, she's had more than most. She's seeing a concierge physician, but there's still a few things missing for me. So what I'm going to do is kind of talk about this is from the JAMA network actually. So niacin. So there's two varieties. There's nicotinic acid and niacinamide. Nicotinic acid has been shown to help with lipoprotein abnormalities. So nicotinic acid is unique because it improves all those abnormalities. So it significantly reduces low density lipoprotein, triglycerides. It's really the only thing that will potentially reduce lipoprotein little a levels. Takes about 1,000 to 2,000 milligrams a day, which some people can't handle. And it also increases high density lipoprotein levels. So I don't want to say good or bad cholesterol because LDL and HDL are lipoproteins. They carry cholesterol. So it makes niacin, and for 50 years they've been using niacin to reduce the markers that are on a lipid panel. Okay, so it's helpful for potentially helping with a wide variety of lipid disorders, including metabolic syndrome, diabetes, isolated LDL elevations, and hypertriglyceridemia. Okay, and then there's changes. So if you believe in the lipid thing, the lipid theory of heart disease, you would think it would be kind of a good thing to take. So there are studies that show there's significant improvements in both coronary artery disease and clinical outcomes. So having said that, the caveat is there are just as many studies that show no benefit, and that's even in combination therapy using simvastatin and and fenofibrate. What you do find with niacin is an improved lipid panel. Okay, so bile acid sequestrants can lower LDL levels by 15 to 30%, so can niacin, so that's kind of how it works. And there's also another cholesterol absorption inhibitor called estimibie. That was approved 15, 16 years ago by the FDA. And that will usually reduces LDL levels by about 1/5. Very little effect on HDL or triglyceride levels. And then fibrates generally raise HDL by 5 to 15%. They will reduce triglycerides 20 to 50%. Effect on LDL is variable, so you would think that a combination of various things would help and get better clinical outcomes. So I have to bounce back and forth here a little bit just to get this right. Okay, so then you look at an article from 2000, if it'll pull up 2017, I believe, that says the lead thing is don't take niacin for heart health, docs warn. So that came out of some of the studies that showed no benefit, and maybe actually, well, no, not really a worsening benefit. But this is from 2014, right after an article came out in the New England Journal of Medicine. If I can find it. I just gotta find it. Sorry, I thought I had this laid out pretty well, but I sort of do and sort of don't. So there are niacin prescriptions that you can get, and before this New England Journal of Medicine article came out in 2014, those prescriptions had jumped 700%. Okay, so they tripled basically in 8 years, from like what would that be? That would be about 2008, 2007 to 2014. The study in 2014 kind of put a halt to some of that. So you can get this as a supplement. You can get it from your physician as a prescription, or you could. And of course, you know, supplemental nutritional stuff is not regulated technically by the FDA. Same way pharmaceuticals are. So the available evidence suggests that having higher levels of good cholesterol, they're talking about HDL, is only a sign of lower risk for heart problems. Okay, and there's really not a whole lot that you can do to raise the HDL except aerobic exercise. You can cook with olive oil. You can change it by lifestyle factors. If you're insulin resistant, you can change that. But as far as like a medication, HDL is a marker that everybody looks at, and so if it's higher, supposedly you have a lower risk of heart disease. So manipulating that with a healthy lifestyle and physical activity is the first step toward improving HDL levels. But there is no particular drug that will raise HDL in isolation. Niacin actually will do that. It raises HDL by about 30 to 35%. So this group feels that niacin should only be considered for people that are high risk for heart attack and stroke who cannot take statins. And we've talked ad nauseum about statins in these classes that I do. So the lowering of cholesterol goes all the way back to 1955. Okay, so the effects really we've gone through. Triglycerides lower. What's the effect on atherosclerosis? Well, imaging studies. And I'm not going to run through all these studies. I could do it, but I would probably bore you to tears, which I might be doing anyway. So looking at coronary angiography, there was a study comparing niacin to cholesterol and a placebo in people who had previous coronary bypass surgery. Okay, so after 4 years, significantly more drug-treated subjects demonstrated non-progression versus placebo. And then there were significantly fewer drug-treated subjects that had newer lesions. So that's a combination of niacin and anti-cholesterol. So another study showing simvastatin plus niacin and then an antioxidant vitamin therapy alone and together compared with placebo. So the antioxidants were vitamin E, vitamin C, 100 micrograms of selenium, and then so that was one, and then simvastatin plus niacin. So what you found was marked clinical and angiographically measured benefits compared just with the vitamin E, vitamin C, and selenium. So that was an imaging study. So what you see on the imaging, so summary of the imaging study is that the results of those imaging studies show that niacin addition or even niacin alone was fairly impressive. So they were suggesting that lipid-lowering effects of the drug are accompanied by the regression of atherosclerosis. Okay, and then a whole bunch of Stockholm ischemic heart disease study, coronary drug project, blah blah blah. I won't go through all of them. Like I said, I would bore you. So, of the clinical outcome trials, the early studies showed a clinical efficacy of niacin. Okay. However, the other studies that I won't name by name, they all have little mnemonics, showed really no help, no reduction in clinical outcomes, basically, is what you're saying. Okay, and then of course there's side effects, and we'll talk about that. So the side effect of niacin, the big one, is flushing. And I've taken high-dose niacin that makes you flush. You have to get used to it. It's kind of, I guess, warming maybe in a way, but you kind of get a little bit of a, well, you get a flush. It's called a flush. And so it's a tingly sensation, and it's from vasodilation. And then I'm going to show you, we're going to talk about a pharmacist. He's called the renegade pharmacist, and his experience with niacin. He's kind of a niacinaholic. Okay, you can see, and this is mainly in this particular article, they're talking about prescription strength niacin, which is kind of a whole different ballgame than supplemental niacin. So you can see elevation of liver enzymes, which you can see with any medication that you take. If you're not getting your liver enzymes checked and you're on a pharmaceutical, you're not being monitored, in my opinion. So liver functions with somebody that's on a pharmaceutical are technically supposed to be checked every 3 months. Most of you all are having them checked maybe once a year at your annual physical. The correct way to monitor people on medications is, especially oral ones, is liver function tests. There is some evidence that niacin raises blood glucose levels and may cause insulin resistance. However, you can see the same. You can see the controversy is that some studies show that niacin is helpful with metabolic syndrome and insulin resistance. And of course, if you don't get a hold of insulin resistance and metabolic syndrome, eventually you get type 2 diabetes. So you don't really want elevation of blood glucose. A couple of studies I read show an initial rise in hemoglobin A1C, which gives you your average glucose. It's a percent over the past 90 days. So, glucose control over the last 90 days. Ideally, you would be less than 5.7%. 6.5% is type 2 diabetes. So there's initial statistically significant rise in hemoglobin A1C, which tends to settle back down after about 3 months. So most of these studies they don't continue the study long enough to show that the hemoglobin A1C in fact goes back down. So the take-home message from the studies is vitamin B3 is known as niacin. Nicotinic acid is the one that lowers cholesterol, raises HDL, lowers LDL. You don't typically get I mean, you can get vitamin B3 from diet. If you have a poor development, if you're in an underdeveloped country and you have a poor variable diet, you can get pellagra. That's vitamin B3 deficiency with a disease state. But there are people that have, the typical thing. I've lost my memory. I'm fatigued. I'm tired. Blah blah blah. And so there may be an optimal vitamin B3 level or supplement that would be helpful. So it was the first pharmaceutical agent discovered to treat hypercholesterolemia. So that's total cholesterol levels. It is potent. It lowers total cholesterol, lowers LDL, lowers triglycerides, it lowers lipoprotein, little a. I've read back and forth on that, and it does raise HDL by about 30 to 35%. Okay. Imaging studies show reduction in atherosclerotic plaque burden. Okay. And then in 2011-2014, the clinical rationale for use of niacin encountered a roadblock when two of those big studies, one of them was 25,000 patients, New England Journal of Medicine, showed that the addition of the drug to intensive statin treatment of patients with cardiovascular disease, so this isn't primary prevention, did not improve clinical outcomes. Well, that's true. I told you that's true of statins as well. There are studies that show statins reduce the first heart attack. What statins do not do is reduce death from heart disease. So what they're saying is in the modern era of intensive statin use, which began in 1996, remember the use of niacin to lower lipids may be of limited value. Okay, and then the adverse effects. So some people can't handle it. The flushing, like I said, which I like, itching, skin rash, indigestion. You've got to you've got to monitor your blood sugar if you're on probably 500 to 1,000 milligrams of niacin or nicotinic acid, and you need to watch your liver enzymes. So the takeaway is it probably doesn't improve clinical outcomes, neither do statins, but my thinking on this, after you've heard me talk ad nauseum about the effect of cholesterol on heart disease, is that heart disease is an inflammatory condition. It really doesn't have a whole lot to do with cholesterol. So if you believe that cholesterol, abnormal cholesterol levels cause heart disease, and niacin improves the lipid panel, and you're saying niacin is of limited value because there's no change in clinical outcome, doesn't that kind of tell you that the lipid hypothesis on heart disease, first started by Ansel Keys, who then refuted it before he died, is not the harbinger of heart disease that we've all been told for 40 or 50 years. So it's almost like they're saying, well, don't take niacin because it doesn't reduce your risk of heart disease, but it does improve your lipid panel. So, what's the deal? So if you believe that lipid elevations cause heart disease, niacin is for 50 years known to reduce cholesterol levels and improve HDL levels, and it doesn't improve clinical outcomes, then heart disease is not a cholesterol deal, right? Okay, so from the renegade pharmacist. So he starts out saying, isn't niacin just another vitamin? Well, that's true. It's vitamin B3. It's an important part of nutrients in your body for your body to function properly. It has to do with NAD, which helps DNA repair in your cells. So it has risks and potential side effects, which we kind of talked about. So what happens when you take niacin? Well, the biggest thing, and most people that take it notice the niacin flush. There's no flush niacin. Somebody asked me yesterday that they had read that the no flush niacin is not as effective. I tend to agree with that. Can't prove it. I don't think I've actually read that I can prove that. Okay, so it's a typical symptom. It causes 20 to 30 minutes after you take a niacin. So I was taking, and I usually take 500 milligrams a day. Your blood vessels dilate, you get a warming sensation, it spreads all through your body. you get some itchiness, usually on your forehead, and your face flushes. So my friends can always tell when I'm within an hour of taking niacin because I get red in the face. That tells you it's actually working. You're vasodilating, right? And then 30 minutes to an hour and a half later, you get kind of a warm glow. So you're warm. That can last for several hours. A little bit like a runner's high. It's kind of how it feels. And then after that, you get a mood elevation. So your energy goes up. You think more clearly. Your brain functions better. I can attest to that. I've taken no flush and flush niacin, and the flushing niacin feels better after you get used to that initial warming and tingly sensation and a little bit of itching. Okay, so it's an um, essential nutrient for production of energy. Okay, if you are deficient, which is rare, and I'm not going to say people have niacin deficiency are going to get pellagra in the United States. That's not going to happen. But you kind of get an energy boost with 50 to 500 milligrams a day. For arthritis, comparing non-steroidal anti-inflammatories like aspirin, ibuprofen, Motrin, Advil versus niacin, niacin is as good for arthritic pain. So for moderate arthritis, and this is from a pharmacist, remember, 1,000 to 1,500 milligrams a day. There's been studies up to 3 and 4,000 milligrams a day for arthritis. We talked about lowering triglycerides and all of the cholesterol, reversing heart disease potential. And this is one of the studies that actually shows improvement of insulin resistance. And remember, type 2 diabetics have a significant risk factor for heart disease. And so people with elevated cholesterol, 500 to 1,000, almost up to 3,000 milligrams a day I've seen. For lipoprotein little a reduction, 1,000 milligrams once a day. Improving memory. There's some evidence there might be some protection from Alzheimer's. This one's actually 1,000 milligrams 3 times a day. That would be pretty intense to take. And then prevention of hair loss. Okay, so you get better blood flow to your scalp. And remember, if you're balding, your hair follicles aren't dead. The hair follicles are dormant. So when I used to do platelet-rich plasma injections with microneedling, the idea was to take the growth factors in platelet-rich plasma, which are a form of stem cells, and return on the hair follicle so that hair would grow. Works great in women, 50% in men typically. Insomnia, so this is niacinamide, not nicotinic acid, but a niacinamide, so that's another type of niacin, activates benzodiazepine receptors in the brain. So that's 50 to 500 milligrams of niacin converted into niacinamide in the body, which help people sleep better. We're not going to really get into cancer because cancer is always controversial, but there is a potential to influence DNA repair through the NAD and NADH mechanism, which is niacin is required for NAD production. That was a class I gave about 3-4 months ago. Maybe some genomic stability and improvement of the immune system, and tends to maybe help side effects of chemotherapy in a person that's taking that for cancer. There are some reports of improvement in acne, and then there's the study I looked at that shows that vitamin B3 may help in protection of Alzheimer's dementia. So that's kind of the scoop on niacin. It is, like I said, sort of controversial, and like I said, I'm having an academic argument with one functional medicine physician about it. I didn't find any evidence, and there may be something that he's going to quote me about increasing calcification in atherosclerotic plaques. So what you want is stability of plaques. Statins may do that. So if you've had a heart attack or a stroke, when I tell people there is a reason to take statins, that would be one of them. If you've had a heart attack or a stroke, There's pretty good evidence that a statin, even a low-dose statin, will reduce the incidence of a further heart attack and a further stroke. So that's it for today. I got it done in under 25 minutes. Talk with your healthcare professional. The recommended daily intake of niacin is quite a bit below 500 milligrams a day. And again, you need to be monitored. True of anything that you put in your mouth that's altering or helping with your body physiology, especially pharmaceutical medications that tend to be synthetic. They do go through your liver, and you need your liver enzymes monitored, and your liver monitored for that matter. So have a great day. We'll see if we're going to hunker down for a big snowstorm. It's saying the Northeast has to, like they're saying it's one of the biggest snowstorms in years. What I'm going to do is keep health coaching. I'll talk to you, what is this, Wednesday? I'll talk to you Friday. We'll talk about something else fun. Okay, see you later. Bye.